Hello everyone, this is Group 11 and we'll be presenting the weekly deliverables. Noble will start first.
Hello everyone, my name is Noble and I'm going to present the weekly deliverable one. So this case is in context of the UHeal Hospital, which is a multi-speciality hospital with a long history of serving the community. To err as human is the response whenever someone commits a mistake, slip, or lapse. In the mentioned scenario, Dr. B is an experienced surgeon well committed to his work, but due to the burnout, he forgets to order for warfarin, which is an anticoagulant, for the prevention of deep vein thrombosis in the patient with the hip fracture surgery. On the other hand, Sophie is a registered nurse who has worked for 8 years in the medical unit and is extremely confident of the medical capabilities of Dr. B. She does not contradict the orders of Dr. B for not prescribing warfarin and thinks that he must have his good reasons for that. However, she aims to ask him the following day but forgets due to tiredness. On the contrary, Zhu W, who is a junior nursing student, catches this error by looking at the order sheet of the patient. He reminds Sophie about it and then she remembers to ask Dr. B, on which the doctor mentions that he must have forgotten and gives a verbal order for warfarin for the patient. So, therefore, realizing and rectifying the mistake on time prevented the patient from developing deep vein thrombosis postoperatively. However, performing a root cause analysis of the problem is essential as it prevents the future errors and enhances the safety of the patient. Equitable distribution of workload is crucial and prevents the burnout amongst the care providers. Recording and reporting the omissions timely without the blame game is extremely important in conjunction to improving the system features such as EMR is also essential to prevent such errors in the future.
Good evening everyone, myself Raj Vindekar. I am representing Group 11 and here I will discuss about the weekly delivery review. Firstly, introduction about the weekly delivery review. It's based upon the scenario and demonstrative scenario is completely based on the medical errors and its outcomes. There was a patient of a 73 years old who was arrhythmic and that means suffering from a heart condition got a handwritten prescription which led to an error in the tablets as he got Synthroid instead of Withmol, that is anti-arrhythmic, and he got medication that was for the thyroid condition. The main cause of the life-threatening error has been discussed and various measures are discussed and suggested to reduce the chances of error in the future as it can be harmful for the patient as well as for the organization. Various reasons for the occurred mistake are kept in the investigating process, such as that error can be occurred due to workload or burnout or something else. So all are figured out. So after discussing about what is the case and how it is related to the medical condition and how it impacted the patient. Firstly, then there is the how system can be improved so that future can be saved in case of medication errors. The system to improve the errors. System improvement which are necessary to make our converse in the form of Swiss cheese model are considered. The Swiss cheese model is like explaining how the occurrence of system failures such as medical mishaps and it's providing overview of the error like where it is happened, where the organization should work to reduce and minimize for the future. To imply different methods, they should imply different methods so that they can reduce the errors and save the lives of the patients by reducing the side effects. They should follow new innovative technologies to utilize for minimized errors. Like they can follow technical support system and a computer based record system like prescribing, prescriptions, dispensing, administration, monitoring. Everything should be based on the computerized design support for entry or for dispensing and for monitoring everything so that errors can be reduced and everything should update it on the digital screen. So that's all about our weekly deliverable 2 that was related to medication errors. So need to be considered. So thanks.
Hi guys, my name is Misha. We'll be discussing weekly deliverable 3. It is the case regarding Cora, who's a geriatric patient admitted in home care center as she fell from bed and didn't receive proper care on time by the student nurse. We will be discussing steps to manage error, evade mistakes in upcoming time, adverse events, apology, impact, root cause analysis, reporting adverse events, and ways to manage falls, like observe the patient and supervise him or her regularly that he or she won't fall, raise the bedsides to avoid fall, check the conscious level blood pressure of the patient before letting them get up from the bed, assess patients like terminally ill or old age patients in walking, and bells can be provided to them so that whenever they want to go washroom or want to talk to nurse or other attendants, it can help it.
Everyone, my name is Navjot Kaur and today I'm going to discuss about weekly deliverable 4. So this case is all about patient safety and human errors in which a dentist was about to administer a wrong anesthetic to the patient. As we know, errors in the preoperative period can often have grave consequences, and hence preoperative clinicians need to be aware of the impact of human errors and how to minimize them. So in this picture, there are some strategies about the error reductions like forcing functions, standardization, parameters and checklists, rules and policies, education and information. In the next slide, there are some unsafe acts in the picture like violations, errors, slips, lapses, mistakes. And mistakes are subdivided into rule-based and knowledge-based. So in this case study, there are 2 points. First is failing to read the drug label before administering the medication. And the second point is the dentist must be informed of the changes in the vial color. So it is very important that the clinicians need to check the vial first, and if there is any changes in the hospital or in the healthcare department, he should know first before any preoperative procedure. Thank you so much, and the next slide will be discussed by Anjali.
Hello everyone, I'm Anjali Patil and I'll be discussing about weekly deliverable 5. This case was about cultural competence and palliative care and hospice care. So in this scenario, there was a Korean immigrant family who had an elderly member who was very ill. So the healthcare staff advised them that they should try to admit the patient into the hospice care. The family got really angry and the situation escalated. Before we discuss why this happened, let's discuss what is hospice and palliative care. So hospice care is given at the end of the lives when little to no prognosis is expected. So the treatment, warmth and comfort of patient's life who is near the end of life due to serious illnesses are the main priorities. In palliative care, it is a little bit similar. Serious conditions like cancer or heart failure, which require specialized medical care, are called palliative care. In addition to the treatment, they treat serious illnesses, and individuals may also get hospital services in the palliative care. So when we were discussing about this case study, we discussed what was the role of cultural incompetence in addressing these challenges. For example, the Western society and the Western countries are very acceptive for such kind of treatment protocols. But if we talk about the Eastern countries like India, for example, we believe that we make sure that our parents or elderly grandparents live with us till they die. So for us, this might be really new. So we should, when working in a multicultural environment, we should focus on how to discuss such sensitive scenarios with the patient. We should always have alternatives ready. We should be culturally competent and educated. So for example, here is a case where Aida, she was a 72-year-old patient who was referred to hospice care. She was under respiratory distress when admitted. She was not eating, she was not smiling. But after the treatment in hospice care, she was smiling, and the family was happy to see her relaxed. Her respiratory distress, it went away. And then after 15 minutes of PT, she died peacefully. So this kind of awareness is needed when you're working with different cultures. Thank you so much.
So our next weekly deliverable was a case study on two different forms of leadership. So the Hippocratic Oath, an oath historically taken by physicians and other healthcare professionals, implies that healthcare professionals will make choices that benefit patients and will protect others from harm. But as we have all experienced many times, we face crossroad when we are confused between two things. Sometimes it is patient's consent or patient's denial to take treatment, but our oath to protect and to give the best care to patient. So given were two cases, first one in which a patient is in ER, incapable of giving consent, and her husband is not responding to the calls, creates a what if situation. Because what if the healthcare providers go ahead with the treatment and the patient didn't want it, in the first place, but they are not able to contact anyone. So the only thing remains is an implied consent. Then second case is where a patient has an advance directive of no surgery, no tube feeding. When the patient has difficulty eating, her daughter requests for tube feeding, as it is not a serious illness but just a nutrition difficulty. Such cases and such scenarios, they create lots of questions like what is important? Is patient's consent more important or their life? Like, will you be saving a patient's life or respecting their decision to end it? Is DNR or DNR is do not resuscitate or not giving treatment breaking the oath we take? Because we are allowing the patient to die or not to choose a treatment. So are we breaking the oath we take? How to address it? Is advance directive followed in all circumstances like given in the second case? So such kind of conflicts and ethical dilemma, they are always surrounded by beneficence, which is to give care to the patient, and the patient's benefit is the priority. Then autonomy, that the patient should be informed about everything he or she will be given as a treatment. And consent, informed consent is the one where the patient gives a consent without any kind of influence. So such kind of dilemmas are always surrounded by these principles, but and it always challenges our decision making skills and critical thinking skills. So this case study was all about that.
Hello everyone, my name is Noble and I'm going to present the weekly deliverable 7. So that was on the strategic planning and techniques for the North York General Hospital, which we have selected for this. So in the weekly deliverable 7, the stability and improvement of the North York General Hospital's care have been discussed by analyzing various data such as vision and mission that are considered a significant part of quality care, comparing previous year's data and discussing various chances. In North York, Ontario, there are 192 long-term and 435 acute beds. It entails offering integrated care, being a world-class learning community, and investing in the future. The goal of NYGH's, that is North York General Hospital strategic plan for the 2020 to 2025, is to think beyond. That's the name of that project, to improve community health. Development of North York General Hospital. This healthcare center was built in 1968. It was built with 50 beds capacity, but later it included more than 500 beds to provide better services to the patients or clients. They started serving seniors, children, and other care seekers. Specialized long-term care department was opened separately. The hospital looks forward to completing its new patient care and tower and long-term care home projects. However, the future will bring the biggest challenge of hiring healthcare staff. There has always been an employee shortage in the healthcare, as we all know. Another challenge would be maintaining the inflow of the patients and deciding on their accommodation, parking, waiting areas, and sanitization. Although there is huge building of the care tower and the long-term home, but still there are many challenges like employee shortage and accommodation for the patients, parking, waiting areas, and sanitization.
Our next weekly deliverable, the eighth one, was about homelessness and healthcare. So the main content was the issues contributing to homelessness, the barriers to healthcare for individuals who are homelessness, how they are provided healthcare, and the key characteristics of quality healthcare for the homeless. So given was the case of a guy named Dylan who was a delivery driver and financially stable in his young age. He had a family, he was living in a two-bedroom house. But later on, he was laid off from his job, which happened a lot in the last 3 years from when COVID started. So he started drinking a lot, he got divorced, he had no money and became homeless. So once he got injured, got infected with fever and chills, and he felt embarrassed about his condition and did not see a doctor until someone called 911 for him. He got socially inactive and his wife left him. He had no money, and the result was he was homeless. So after going through a lot, he was later approached by a team who treated him with respect, and then he was offered behavioral therapy. His condition progressed a lot. He was showing excellent progress. He started getting involved socially. He quit drinking and started looking for a job and for a home with the help of the recreational team. Discussing about this case scenario was very interesting for our group because all of us had some experiences with homeless people in our whole life. So when we were discussing about it, the main point was that most of the homeless people have had stable life at some point in their life. They were educated, they were financially stable, and something just changed in their life and they became homeless. So we reviewed that how behavioral therapy can prevent this from happening and can rehabilitate a homeless person. That rehabilitation and support from professionals like from psychiatrists and like from the medical staff could help the homeless people rehabilitate and start a new life. And there should be healthcare support for homeless people. Sometimes they are not able to contact the hospital directly, they are ashamed or embarrassed about themselves, so there should be, and we can make some changes in the society such that people start taking responsibility for the homeless people and they contact the healthcare and the hospitals whenever needed. This was our weekly presentation 1 to 8. Thank you so much.